In tonight's Hometown Health, there are at least 10 million people in the U.S. with osteoporosis and at least 50 million who have low bone mass.
WDBJ 7's Caitlin Francis is here to tell us about a new program at LewisGale called Own the Bone. Hey, Caitlin.
Hey, Chris and Melissa. So yes, that program is meant to help all of those people, some staggering statistics there, who are most at risk for bone fractures. But I learned there are some things we can all do, regardless of age, to stay healthier. Own the Bone. It's a program all about helping people prevent fall injuries, and it's something Dr. James Leipzig, the surgeon spearheading the program at LewisGale, brought to the area because of his own mom.
She fell and broke her hip and had to have surgery, and it was a very big ordeal. And even though I had seen, really hundreds and hundreds of people go through hip fractures, I never really understood the impact that it had on a person's life and the family's life.
So he talked to his mother's orthopedic surgeon about treating her underlying condition, osteoporosis. That's when he discovered there was a huge treatment gap.
Only about 20% of people in the U.S., patients in the United States, are actually treated for their underlying condition, which is the osteoporosis.
Another really alarming statistic:
20% or more of hip fracture patients die within a year, and up to 50% of hip fracture patients never live independently again.
That's where Own the Bone comes in. They're working to bring awareness and educate people on fall risk and prevention. And risk factors include genetic history, being female, being underweight, and having a history of smoking. But there are easy things we can all do to keeping our bones healthy.
You need to be on vitamin D.
It's crazy.
2,000 a day.
And we should all be taking 1,200 milligrams of calcium a day as well, but it's better to have that come from dietary sources.
What we can do is hopefully prevent future fractures and really impact a lot of people's lives.
Dr. L says if you're older, make sure you ask for a bone density scan at your next physician's visit. And moving forward, Melissa, the goal is to open an outpatient clinic where patients can actually call and get screened in an effort to prevent that first fracture from ever happening in the first place.
Yeah, I hate to hear that about his mom, Caitlin, but nothing like good motivation to bring some good things here to this area.
Right.
Yeah, thank you. All right.